My name is Bryan Sexton. I'm a psychologist at the Duke Department of Psychiatry, and the study that I'm going to talk about today is the well-being intervention. It's an randomized controlled trial that we used on healthcare workers to show that we can cause improvements in well-being across a variety of well-being outcomes. For the objective of the study, we basically used five 10-minute activities that were embedded within a continuing education uh, framework. Hour-long continuing education sessions, we would put 5 to 10 minutes in each of them to reduce emotional exhaustion. Um, and it worked more than COVID increased emotional exhaustion over 3 years. And 90+% of the healthcare workers that tried it, they rated it favorably. And so we use these little kind of 10-minute activities to give healthcare workers a chance to briefly, reflect on some of the things that are not a disaster in their lives right now. And through this, what we call micro dosing of positive emotions, we were able to get a pretty cumulative and powerful impact on their well-being. The results were across four different well-being outcomes. The first one was emotional exhaustion. That's basically the most common way of people measuring burnout. And emotional exhaustion came down quite a bit. That actually improved the most. Second was emotional recovery, which is your ability to bounce back after an emotional upheaval. So the other two domains that improved were work-life integration. So, sleeping better, taking breaks, taking care of yourself. That improved, as well as emotional thriving, which is to what extent are you kind of flourishing on a day-to-day basis. So those are the four domains: emotional exhaustion, emotional recovery, work-life integration, and emotional thriving. And they all improved within 8 days. Burnout and stress and disruptive behaviors and staffing problems, all these things that are so critical right now in healthcare. They're an ongoing crisis for healthcare systems. And this intervention targeted emotional exhaustion, which is the number one driver of all of those things. It drives patient engagement, medical errors, infection rates, mortality rates. It's all driven by emotional exhaustion of the workforce. So this well-being intervention, in brief, was this simple but effective intervention that works on demand. You can do it, now whenever you want. You can do it from a phone or from a tablet. And it's effective for every group that we studied, every demographic group, across gender and race and ethnicity and roles and years of experience, people who are clinical, people who are non-clinical, all roles, all disciplines. It was effective. And just the fact that 9 out of 10 said this is pretty good is that's unusual for a well-being resource. There's just so many people that like to poo-poo well-being resources, and in fact, there are a lot of well-being resources that should be kind of dismissed as being unhelpful. So the fact that they liked this one, we actually think that's one of the more important outcomes, is that they liked it. The 5 hours that we used to do this training is called Well-Be Essentials. That can be the start of a journey for many people. A lot of folks that finished the intervention would come back and say, these tools, they're pretty cool. I shared them with my adult children and with my spouse and with my colleagues, and I kind of want, you got some more of where that came from. And we developed a 17-hour program where at the end of 17 hours, that is the training that we give for our well-being ambassadors. And so what is the future? Where is this going? We want every single healthcare work setting everywhere to have someone who is the go-to person for well-being in that work setting, that can bring the science and the research and the really good options to bear on local problems. Everyone kind of likes to say, fix the system. Yes, we have to fix the system, but the way you fix the system is by making sure you've got reasonably kind of tailored approaches for every single work setting. And that's going to look different in every work setting. And to that end, we want to build infrastructure and capacity to do that. So we created this well-being ambassador training. We've trained 800 well-being ambassadors at Duke and over 17,000 nationwide. And we want that to continue to grow. We want people to be able to kind of use the best available science. We want them to be able to use the best available resources. And what we found in this process is that it's not the number of well-being resources you have on your list that matters. It's the quality of the well-being resources on that list. So having several things that are really good is much better than having dozens of things that are all kind of lousy. And unfortunately, what a lot of health systems have right now are lists of dozens of things that are all kind of lousy. WellBe, this intervention is free and open right now to try it out for anybody listening and to share it with others. There's a lot of uncertainty in the world right now, and it's time to regain some of what we lost in the past few years. And so I encourage folks to go out and try things for well-being and to share what works for them with others. And so if you don't like what we're doing, fine, go do something else and then share that. But my message to folks is just right now, it's really important to be a light in the darkness.